Hello and welcome back to the channel. I hope you're all doing good. So today's video is going to be for the OET candidates. I thank you for the response on the channel. I see quite a few inquiries who are interested in some online coaching, and the classes have already started. So thank you for that. However, one thing for the airline candidates, I do not see much of response. You watch the video, you do not show much of an engagement, or right, like last few videos I've been trying to make some detailed videos for you so that you can actually understand the insides of an aircraft and understand the cabin crew role. However, I see very few views on that, so it's quite demotivating. So it's very simple. I'll be focusing on candidates who show more response. If it's OET candidates, it will indicate to me that yes, I should make more OET videos. So if you want to get some more good content, support the channel, guys. Right now there are around 578 of you subscribers, so do support the channel, right? At least I should get 1,000 subscribers. It's not too much to ask for, right? Even if you have one member in your family or someone of your friend, you can definitely ask them to subscribe. It doesn't cost anything. Okay, anyway, thank you for the response, whatever response is getting right now, because my focus is to put only quality content, and of course I'm not putting any money into any Google ads or anything for now. Anyway, let's begin the role play. So today's role play is going to be for a patient who had developed a urinary tract infection after surgery of colon. All right, so let's read the nurse's part. Hospital ward. Nurse: the 72-year-old patient has developed a urinary tract infection after he underwent surgery 4 days ago for cancer of the colon. He was commenced on antibiotic and Urel. The patient lives with his wife, who has chronic obstructive airways disease and is partially blind and very reliant on you. He is concerned about a prolonged stay as his wife is home alone. So task 1, answer the patient's question in a reassuring manner. Second, ask the patient about his or her general health over the last 6 months and how he has been coping up at home. Third, sympathize with the patient and try to calm them down by offering home help for the care of the patient's wife. Give advice about diet and lifestyle to assist the patient to cope better. So guys, as you all know, 3 minutes time for preparation and 5 minutes for the role play. So let's begin. I'm going to, of course, I'm going to be playing both the patient and the nurse's part as well. So let's start. A very good evening. My name is Ashish. I'm the registered nurse here today. How may I help you, sir? Hello. The problem is that I just went through a surgery of colon 4 days ago. Unfortunately, after that, I have developed a urinary tract infection for which I am on medications. Moreover, my wife, she's blind, and she's partially blind, and she's alone at home. I'm very concerned about her condition because there's nobody there with her, and moreover I have this problem. Now I'm concerned because she also has a chronic obstructive airway disease. So I wanted to ask you a few questions. Yes, sir. Sir, I'm sorry to hear that. I can understand it must be hard for you, but let's see how we can make things better for you. Yes, thank you for that. But I have 3 questions from you. First of all, how long will I need to take this medication? Secondly, how long I'll have to be in the hospital, because I really want to go home. I completely understand your situation, and I do empathize with you. And so for the first question, how long you need to take the medication needs to be taken for another week or 10 days. And depending on the kind of progress, the way you're responding to the treatment, it will take approximately 7 days on an average, or if it takes longer, it might take more, maximum 10 days. After 10 days, you can be discharged and you can go home. Okay, thank you for that. Second question is that I want to, third question is that I want to know, at my age of 72, don't you think chemotherapy will be dangerous at my age? Well, I completely understand that you might have heard, that chemotherapy has side effects or is dangerous. However, let me assure you, chemotherapy is one of the best treatments available in the market right now to treat the cancer patients. And looking at the current stage which you are at, this is the best treatment available, because if we do not do a chemotherapy, your condition will deteriorate further. As far as your age factor is concerned, don't worry about it, because I have seen patients who are even 75 plus and they have taken the chemotherapy and they have healed. Today they're living a very healthy life, sir. So don't worry about that. Although there will be certain side effects, but the benefits of the benefits outweigh the side effects. The side effects will be mild and they'll go over a period of time. But it's extremely crucial that you take the chemotherapy right now, so that your health becomes better. And sir, apart from that, I also wanted to ask you, how has your general health been over the last 6 months, and how have you been coping up at home? Well, about my general health, to be honest, I feel lethargic, weak. I even had an episode of unconsciousness. I'm sorry to hear that, sir. So how have you been coping? So I've not been really doing that good. Actually, my main concern is not that. My main concern is about my wife, because she's alone at home, as I told you, and I really want to go back because she's partially blind. What can you do about it? Well, I completely understand your situation. How does it sound if we arrange a home help for her today itself? Yeah, today. That'll be great. If you can do that, that's going to be really good. That'll be very helpful. Yes, sir. So what we're going to do is we're going to arrange a home help for her immediately. I'm going to fix the appointment today itself. That's wonderful. Thank you very much. And apart from that, I would also like to advise you about your lifestyle. I would suggest you to move to some healthy diet, have more fruits and vegetables, and try to be active, so that you keep moving. So that if you keep moving, your health will become better. If you do not, the more inactive you are, it will affect your health. Plus, try to talk to people who are positive, who are your friend circle or your relatives. It will show an effect on your health for sure. So yeah, that I would like to suggest to you. Okay, so sir, I just explained. Okay, thank you for that, sir. So I just explained to you how chemotherapy is good for you. You should go for it. Secondly, I arrange home help for your wife. Will be arranging, and I also advise you about your diet. Is there any other question that you want me to answer? No, that's about it. Thank you. You're very helpful. Thank you, sir. Very welcome, and you take care. Bye bye. Okay. So guys, you just saw how the role play was performed. The first thing was about empathizing, right? Empathy is very important. You saw how I'm using the sentences. Empathy with the patient depending on what the situation that the person is. Second thing is I inquired. So how do you inquire, right? Inquiring about the general health, and then finally offering a solution, right? Look at the tone that I'm using. I always modulate. I modulate my voice so that it becomes, it's more effective. So I'm really happy to share all this with you. And a very good news again for one of my students who went there. He got 3 offer letters from one of the top IT companies. And he just shared the news with me yesterday. There is a company called The Judge, which is into IT recruitments. He shared the news yesterday with me. I was very happy to see that, okay, I can have some effect on success of the individuals. So thank you very much for that. And of course, if you need one-to-one coaching, you can always contact me. Batches are already going on. Thank you very much. And leave your comments in the comment section. Take care. Bye-bye.